In this video, I'm going to show you many myofascial techniques, from deep tissue massage techniques to spinal manipulations, and also some trigger points techniques. But this video is just for educational purposes. It is not intended as medical advice. As you see, now I'm evaluating the patient. I am evaluating the cervical spine movements. It's evident that the patient has some restrictions, and actually she also says that she has on the right side more tension. Yeah, as you see, she's pointing the tension she has from the cervical spine and also to the lumbar spine. Also, she's telling me that she has some issue with her right foot and also the calf. She has tension on the right calf, but she says it starts from the lumbar spine. I'm starting to evaluate the iliopsoas muscle. As you see, I'm I'm perceiving the right psoas really tight, really tensed. She's also telling me, yes, when you push, I feel more pain on the right side. Now I start the treatment for the right iliopsoas. Specifically, I'm pushing with my left hand through the right psoas, the iliac part of the iliopsoas. And I'm also grabbing the knee because I want to activate the psoas. I'm asking her to keep the flexion of the hip. As we know, the psoas, the iliopsoas, flex the hip. So I'm creating a contraction, and that helps me to relieve the psoas more. It's like a functional release technique. I keep the compression, the ischemic compression, and I also add some movements from the hip. So I also add flexion and extension. This is a passive movement. I'm doing it myself, but I can also ask the patient to do it. Usually it's not really, it is bearable, but it could be a little bit painful for the patient, this technique, if you push too much through the psoas. So be gentle. Yeah, you need to be patient and do the technique at least until you feel the muscle relieving under your hands, in this case under my left hand. Now I feel it I feel it better, so I switch to the other side, and I try to do the same on the left, on the left iliopsoas, but I tested again, the right and the left, and she says, yes, but I still feel the right more tensed. So you always need to test. So that's why I prefer to keep working on the right. So as this time from this side, I do an ischemic compression. So I work on the iliac part of the iliopsoas, and I push through the psoas. I keep the compression. It's gentle, but I just keep the compression until I feel the muscle less tense, less contracted, let's say. In this case, this patient had the right iliopsoas really contracted. So it took me some time to relieve it. Yeah, she's breathing normally. Now I feel that the muscle finally is improving, and I yes, actually now I switched to the legs to evaluate the ankles, and also I touched the quads to see if they were contracted, if they had some imbalance. So I asked the patient to turn on her stomach, and I start to palpate the quadratus lumborum, which is really important, as we know, for low back pain in general, for the posture. So I feel the left quadratus lumborum really tensed. So that's why I cross the left leg over the right leg to create space on the left quadratus lumborum, and I start to massage the quadratus lumborum on the left side of the patient. I gently start to palpate it and to apply some ischemic compression. As you see, I also move the lumbar spine a little bit. I push through and I rotate a little bit, but it's really gentle. I usually don't use any oil or cream, but because it could glide too much. So you can use it, but just be sure that you have control with your hands. Now I'm yes, now actually decided to put some cream, but as you see, it's just a little bit. So yeah, I applied the cream, maybe because I saw that the area were becoming like too much red because of the blood circulation. So that's why I decided to put the cream, and I start massaging, and I glide through the muscle easily now because I applied the cream. So as I told you, yes, you can apply it, but just a little bit. It shouldn't be too much. You need to have control of what you're doing, of your movements. So as you see, I also use the other hand to palpate the other quadratus lumborum, so the one on the right side, which is not really tense, but just to create like a good perception for the patient. I use both hands, and I also go to the other side. You always need to test and treat the muscles. You don't need to be robotic. You can move because everything you do, the patient will perceive it. So we are all connected, as you know. This really holistic. It doesn't make sense to stay on one side, to don't touch the other parts, to don't pay attention to the other parts of the body. This is a general topic, but just to mention it. Yeah, I feel it more, less tense, less contracted, as you see, because I can move both hands easily now. There are there is less resistance against my hands. And now I apply some ischemic compression because I can now without causing too much pain to the patient. Now the quadratus lumborum is more relaxed, so it's bearable, this technique, without causing too much pain to the patient. I can apply ischemic compression to the trigger point present in the quadratus lumborum. Now I ask some contraction just to mix the techniques and to be more efficient. I do some functional release technique. So I use the contraction of the muscle I'm treating just to be more effective. You don't need too many techniques to have a good feedback, but you can mix some really good techniques when you do an holistic treatment like I'm doing now. Yeah, actually, as you see, the patient is moving from time to time, and she's speaking actually most of the time. And it depends on each patient, but you should let the patient speak. If she wants to speak, she needs to speak, and that's what I suggest you, because otherwise she wouldn't allow you to work properly. She would be tensed. So just let the patient do whatever she or he feels to do. All right. Obviously, you need to be focused on what you're doing, but the patient can speak. You can reply. Obviously, shouldn't be like a big conversation, but let the patient speak. This is going to help you a lot. Yeah, now I switched to the right side, even though there is not much tension there. But as I told you, I want to create balance. Maybe you didn't notice, but I crossed the left leg over the right leg of the patient. But I also asked the patient to raise her left arm just to create more space on the left side and to be able to treat the quadratus lumborum better. Now I'm testing the piriformis muscles. It's so evident that the right piriformis it's really contracted, but really contracted. So that's why I start with this technique. I flex the knee and I start with the ischemic compression right away, gently, but uh, I start with the ischemic compression now with the elbow directly. Actually, I cut the first part where I were just palpating the piriformis, but I can be a little bit more aggressive here because the piriformis of this patient was really tight. I'm also asking a contraction, so I'm asking the patient to turn and to push the heel, the right heel, toward the wall, so toward the left side, so that when she can contract the piriformis muscle, and I'm doing also like an intra and extra rotation of the hip. So this is a functional release technique again. Also for the piriformis muscle, we use this technique and we combine it with ischemic compression, as you see. Actually, if you maintain the same pressure, it's not really painful, this technique. Yes, could be painful. That depends on the patient and also on how much the muscle is contracted. But if you just keep the same pressure without increasing it, it's not so painful. It's effective and not so painful. You can switch from pushing through the elbow, also um, using just the thumbs, even though I don't suggest you to use just the thumbs because you are going to hurt yourself if the piriform is really contracted. So you have many parts of your body to use. And by the way, use your body because otherwise you're going to hurt yourself. As you see, I'm with my body. I moved my body forward. I'm leaning forward, and this is helping me to be more efficient. Yeah, this treatment took me some time because, as I told you, the right piriform is where uh, was the right piriform was really, really, really tight. I move. I I move because I want to look for the fibers that are really contracted. I go back to the functional release technique. So I combine the ischemic compression with with the movement of the hip. So I do the intra and extra rotation, and I keep the ischemic compression. I keep doing this technique until I feel the muscle really relaxed or significantly relaxed. Now I'm switching to the upper part. So I'm testing the trapezius, I'm testing the cervical muscles, and I'm also starting to massage this part from this position. Then you'll see that I'll treat the cervical with other techniques as well, but I'm just like preparing the patient and the muscles to receive other techniques. Now it's really gentle, the pressure I'm using. I'm just massaging the trapezius. And as you see, I'm also testing, I'm also checking which part is more tensed. The patient has the cervical spine, the cervical spine muscles really, really contracted, really tensed as well. Yes, now as you see, I'm speaking as well because she was asking me something for sure. So yeah, you need to be relaxed as well and focused at the same time when you work on a patient. But what is really important is that you feel comfortable, you keep having a good energy because otherwise you wouldn't be able to transfer a good energy to the patient. So that's why I suggest you to keep the flow, actually, to keep having a good attitude while you apply manual therapy techniques while you apply any massage technique. Well, as you see, I kept massaging this area for quite a while, but here I switched to a rib manipulation, which it's not really common, but it could be really effective. And as you see here, I'm doing some direct manipulation on the thoracic spine as well. But the patient, it's really easy to do it now because I already worked on the muscles. So the muscles are not so tight. Now I'm doing the same rib manipulation on the other side. And now I ask the patient to lay on her back again. I'm evaluating the ankles. And as you remember, the patient said that she's having discomfort and pain on the right foot. So I decided to palpate the fascia, and I found a spot where she's really tensed. So I decided to apply ischemic compression there. You need to be gentle here because this part of the body is really sensitive. I'm also asking the patient to move the ankle up and down, to move the foot up and down, and so to apply a functional release technique. As you see, she's smiling because she wasn't able to do the movement properly, but then finally she did. Yes, as I told you, you need to be gentle here. This is really effective. Ischemic compression on the plantar fascia is something really effective, but could be really painful as well. So be gentle. Just maintain the pressure and wait until you feel that it's relieving under your hands. In this case, I'm using my thumbs mostly. The patient now, as you see, she's talking a lot. And as we already said, this, you shouldn't stop the patient. If she wants to talk, just keep the conversation and keep your focus on this part. Obviously, if you're doing like some specific technique, you shouldn't talk. You need to be focused, but with time you are comfortable to switch from having a conversation to be really focused on a technique when it's necessary. Now I'm moving the foot while I combine the pressure, and now I switch to the manipulation. So I'm going this thrust manipulation to relieve the ankle, and then I also do a metatarso manipulation, and then I go back to check the psoas, which is now good, and I switch to the lumbar roll manipulation. This bed here is really high, so it's not so comfortable to apply this manipulation, but as you see, I managed to do it anyway. And this is the thrust right there. Yeah, she's smiling because this is, yeah, you didn't hear the crack, but there was a big crack there. Now I'm doing this thoracic lumbar manipulation. And now I start palpating the cervical muscles from this position, just to recall the preparation for the cervical manipulation we will do in a while. We already worked a little bit on the cervical muscles from the other position, but it's important to have the muscles as relaxed as possible before applying the manipulation. So this is what I actually do. This can be different from therapist to therapist, but this is what I recommend. Just make sure that your patient is relaxed and the muscles are not too much tight before doing the manipulation, because this could be a lot better if you do that before applying spinal manipulation. Obviously, you need to have a good experience to do these manipulations. And as you see now, yes, I'm doing the first one. I use some trick to make sure that the patient is really relaxed before applying the thrust, and it's really important, because the patient, if the patient resists to your thrust, she could have some muscular pain, or well, it's not so comfortable. So you need to be really fast and skilled to do these spinal manipulations safely and effectively. Now I retest, and an immediate feedback of the spinal manipulations is the immediate relaxation of the muscles. Well, there are many immediate reaction, but one of them is this like immediate relaxation of the muscles. In this case, of the cervical muscles, and she feels it. She were telling me that. I also feel it as well, and it's almost shocking how fast is the reaction, how fast is the effect after a spinal manipulation well applied. So I always use these techniques to after the treatment, after the spinal manipulation as well, just to make sure that the patient is relaxed before doing the test again. And now we'll see how the patient feels. It's not fake. This is so real. So she's telling me that she feels both sides more relaxed, but when she turns on the right, she still feels something. So she's pointing me at the spot where she feels something. On the left side, she turns good. She says yes, that's fine now. But on the right side, she still feels tension, discomfort. It's not pain now, but she still feels, yes, some discomfort there. So I apply some gentle manual technique. This is a functional release technique on the scum, on the sternocleidomastoid muscle. So I do this just to see if this is enough to fix the last discomfort the patient has turning on the right side. As you see, I use this technique here, so I don't apply direct pressure on this muscle, on the scum muscle. Also because, as you say, it's not so good for the patient. This area is really sensitive. Now I'm asking, do you still feel? Yes, she says, yes, I still feel the discomfort. So this technique wasn't so effective. So that's why I'm going to apply the spine manipulation on the lower cervical spine, and in this case on the right side. So as you see, I flex the neck a little bit more, and just to target the lower part of the cervical spine, which is still restricted. As you see, she feels, yeah, she's smiling already, and she says, yes, actually you didn't hear the crack here, but yeah, that was like a big sound. And now she says yes. Yes, now yes, and now okay. This was, yes, the big reaction the patient had. So you always need to test and retest and treat. Now I'm doing this cervical thoracic manipulation, but I ask the patient to get closer to me so that I don't get hurt. And here as well, the patient had a really great relief. This technique also is great if well applied. Now, while I check the shoulders, I do peripheral manipulations on both shoulders, but this is just like the end of the treatment. Well, something's missing, you'll see in a while. We will do, yeah, I recheck the movements of the cervical spine, and then we're about to end the treatment with some peripheral manipulations on the elbows, on the wrists. The patient's so happy. As you see, she changed her attitude. She's so relaxed now. She really, she's, yeah, she's, as you see, well, the images are so clear. If you're a therapist, check our courses in the description. Subscribe to the channel, like this video, share it. See you in the next video. Thank you for watching.